Hello, hello, soon to be BSNs. Let's get this course started by looking at how to apply the nursing process to a management problem. Before we go any further, I want to introduce the pause icon to you. Anytime you see this pause icon, it means that I'm going to ask you to pause and either reflect or actually do something. So you want to make sure throughout this course you have a pen and paper available and you're ready to take notes and utilize the pause button when you're asked to do so. So for the first one, since we're looking at how to apply the nursing process to a management problem, I want you to pause and reflect on two questions. One, what is the nursing process? And two, how do you currently use the nursing process? So think about those concepts and then hit play when you're ready to continue. Go ahead and hit pause now. The American Nurses Association says the common thread uniting different types of nurses who work in varied areas is the nursing process, the essential core of practice for the registered nurse to deliver holistic, patient-focused care. Now I want you to pause the video, write that definition down, and underline what words feel like they are keywords to you. When you're ready, hit play to continue. Pause the video now. Okay, so what did you find important? What did you think the keywords were in this definition? For me, the keywords were common thread, uniting. Different types, as in more than one, not just a bedside nurse, in different areas across the hospital and beyond the hospital. Essential core, I felt like, was key as well. And then holistic, patient-focused care. So anytime I talk about the nursing process, I like to share this story. Because a lot of times people think the nursing process is one of those things that you learn in nursing school that has no application to real-world practice. But the story I like to share is the day that I truly became a nurse. Now, according to the Mississippi State Board of Nursing, I became a nurse in May of 2003. However, I would tell you that I became a nurse about 10 to 11 months later. I can remember this day more clearly than I can remember my graduation from nursing school. A patient called out. I went into the patient's room and they told me that they had a problem. I completed an assessment, diagnosed the problem in my head, created a plan of what should happen, and I implemented the plan. And then I made a note on my to-do list to come back in 30 minutes and check on the patient again. And when I walked out of the door, I literally came to a halt outside of the patient's door and thought to myself, that's it, I'm a nurse. And I knew I was a nurse because I had walked in that patient's room and applied the nursing process and never gave it a second thought. I didn't even have to think about it. It was second nature. I was a real nurse now. And just as I applied that nursing process at the bedside of a patient, you can apply that nursing process in any area of nursing, because we remember that it is the common thread that unites different types of nurses who work in varied areas. The nursing process is just as effective in management as it was at the patient's bedside. And so that's it. That's the whole purpose of this course, the big goal that we're hoping to achieve, to help you apply the nursing process to a management problem. So let's get to it.